Good morning, I am Harmonie Massiah and I am the National Epidemiologist for the Ministry of Health, British Virgin Islands. Well, for the past 2 days, I have been saturated with information pertaining to health systems and analytics, and I found most of it to be very relevant to what I am currently doing. And that's because as the epidemiologist, I deal with statistics, I deal with collation, I deal with analyses, and not only that, I'm responsible for training my team. So a lot of the like EpiInfo, the statistical software I was being reintroduced for, I was like, hey, well, this is something I can also teach to my team as well and give them a little bit more diversification in the software that we're currently using. For me, it was something that I knew prior, so it was almost like a refresher's course, but it clicked to me that this can be something, along with data, that I can teach them to use. My main interest actually was in the GIS spatial mapping because right now they're doing a lot of cases trying to find the causal agents for a lot of cancer. And what they're doing with the mapping is that they're putting the cases on the maps and determining whether or not a certain environmental agent may be responsible for the disease. So I really wanted to get my fingers into learning about the GIS mapping software. And that's pretty much it. But so far I've found a lot of these sessions informative. And a lot of it I am going to take home and teach to not just my team, but also to other departments like environmental health, because they can also use the GIS mapping software to help them track their vector-borne diseases and cases. But one thing I really want to relearn or for to be introduced is predictive analytics, especially regarding infectious diseases, because this will actually help us to maybe facilitate training, allocation of resources, and even help us to be prepared in the event that there might be a spike in infectious diseases, especially since a lot of the software are taking into consideration climate change and how especially vector-borne diseases may change over time. So this will actually help a lot of countries be able to prepare in advance for what might be.